Hi, everybody. We are back for navigating hospital specialists and medical appointments. In this part, we're going to talk about the benefits of seeing specialists, which partners with everything in this section, the idea of not wanting to go to the hospital and the idea of getting better medical care and recovering more quickly. I'm Pamela D Wilson. I'm your host. I'm your instructor for this section. Let's start with our usual housekeeping projects. I use the term elderly parent or elderly parents for the person for whom you are providing care. Outline and slides are in the module. Do print it off. I will ask you to take notes. The ellipses are there on purpose so that you can follow along with me for the slides. Let's talk about objectives for the benefits of seeing specialists. At the end of the benefits of seeing specialists, you should be able to recite the benefits of seeing a geriatrician, relate 10 ideas about geriatric care to support advocacy, and list the benefits of seeing medical specialists. Babies are treated by doctors called pediatricians. As we age, there is a specialty that treats adults over the age of 50 or 60 who have these multiple chronic care conditions, and this person, no surprise, is called a geriatrician. A geriatrician is a physician who has additional education to specialize in treating the health conditions of older adults. The study of gerontology is the study of the process of aging. Geriatrics is the specialization of medicine that focus on the health and care of aging adults. And it goes beyond just getting a regular medical degree, a regular MD. These truly are specialties in geriatrics, and we'll talk about other specialties. As an aging adult and as a caregiver, it's helpful to know how geriatricians think about managing the care of aging adults. This information is useful so that you have an understanding of how to help yourself if you are an aging parent, and how to advocate for elderly parents at medical appointments, because honestly, we're all going to age. So learning this today has benefits to everybody in a care situation. Sometimes we all feel that we are rushed in and out of doctor appointments. By helping elderly parents prepare for appointments, health issues can be addressed. As a result of being prepared, you'll feel better about your relationship with the doctor and with the medical practice. Geriatricians appreciate receiving current and factual information to help with treating elderly parents, and they usually are more patient. Physicians, on the other hand, who do not treat older adults, who are not geriatricians, may lack patience, and as we talked, they may be biased in their opinions about treating your parents. They may just think they're old. When you hear something like, that's what happens with age, realize that that physician may not be the right physician for your dear elderly parent. I want to talk about 10 ideas about geriatrics and aging, and these are 10 ideas that came from Emory University. I've changed some of the medical speak to make the information easier to understand because it was presented more for a geriatric specialty healthcare system. So the information will be easier to understand, and I've added some additional descriptions from my experience. So number one, aging is not a disease. That means that aging alone doesn't cause geriatric syndromes or illnesses. Some aging adults are very healthy. On the other hand, some have multiple chronic health conditions that cause significant difficulties in managing the day-to-day. However, aging does make it likely that diseases will occur. It's why this close monitoring can avoid problems. It's why regular doctor appointments, checkups over the year, preventative measures, it can help avoid all of this so that aging doesn't have to be a disease. Number two, aging adults have chronic diseases. According to the statistics, 60%, 40%, usually more than one chronic disease that may act together against each other. That again relates to geriatric syndrome. Having more than one disease makes managing the care of aging adults more challenging for doctors, And it's why seeing specialists who treat a variety of conditions is beneficial. Number 3, health conditions in aging adults are usually underdiagnosed and are not treated. And this happens from a couple of reasons. Our elderly parents don't know what they're looking for. They don't know what signs to report about not feeling well. We as their children don't notice it. And so this general lack of observation, this general lack of education is the reason that it's essential for caregivers to attend medical appointments. And also, if aging adults don't notice changes, they're not going to go to the doctor on a regular basis. So it's kind of this circular issue of, I don't feel well, but I don't feel bad enough to go to a doctor, and it's not bad enough, and then it turns into a bad situation, and now I have this syndrome that's difficult to treat. I had a client who lived in an assisted living community, and she had a lot of health conditions, but we were very good about monitoring them because we knew that one change in one would result in this perfect storm that would end up in the hospital. I had directed the staff in this care community to call me anytime there was a change in blood pressure, which for her was a significant indicator that she was probably dehydrated or something else was going on. So I would get a call, the phone would call, and they would be like, oh, your client blood pressure is low. What do you want us to do? I'm like, okay, how much has she had to drink today? Has she gone to the bathroom? Has she urinated? Probably dehydrated. Give her liquids. I don't care if it's Diet Coke, water, juice, Jell-O, ice cream that melts, whatever it is, get it down her and get it down her very quickly and continue to monitor her blood pressure and keep calling me back. And sure as I knew it, within 30 minutes, that usually resolved the blood pressure issue. So knowing what issues your parent has, knowing what happens from those issues is extremely important in avoiding hospital stays. And many of these little tips and tricks you can get from seeing specialists if you ask the right questions. Let's keep going with these ideas. So more ideas about geriatrics and aging. Let's revisit the connection between physical strength and ADLs and IADLs. So number 4, the ability to perform ADLs and IDLs makes a significant difference in the quality, QOL, do you remember that acronym, of life for aging adults. We now know this. Even small improvements in one physical strength, balance, or mobility can make the difference between staying at home and moving to a nursing community. How many of you remember those statistics for improving balance, improving muscle strength? I think they were all 60% and above if and only if somebody participates. All that research confirms that we start losing muscle mass at the age of 30. By the time we hit 80, if we don't do anything else, we've lost 30 to 50% of muscle mass. That loss of muscle mass affects, what do you remember? Balance and the ability to perform ADLs. Number 5, managing the care of elderly parents depends on several aspects that include the availability of family caregivers, paid caregivers, personal preferences, resources like education. Having an action plan for care is beneficial. That's what this whole program is about. It's taking action. Family involvement in caregiving when the family is available provides significant support. People without family who live alone, they have to be more diligent in planning for care in their later years. That plan maybe include friends. It could include the idea of hiring private assistance, but there has to be a plan. Because of multiple health issues, caring for aging parents often requires what we say a village, and that means specialists, nurses, dietitians, physical therapists, and other people who are involved to help with managing all these multiple conditions. And this really is the point where elderly parents have to commit. They have to commit to participating to improve these health conditions. Otherwise, the health conditions will continue to decline. There will be more hospital stays, and the situation will progress to an end-of-life situation. Next, memory loss and depression are frequently undiagnosed. We talked about this. Some elderly parents don't respond to the yes or no questions the right way. Their first response is a no. No, I'm not depressed. No, I'm not this. No, I'm not that. But again, remember when you ask about circumstances, are you doing less than you were before? They say yes. So it's all about knowing how to ask the right questions. And also, people who have memory loss can't always tell their physician how they're doing or how they're feeling because honestly, they don't remember. So it's just difficult all around. The last ideas about geriatrics and aging. Poor medication management results in hospitalizations for aging adults. It's actually the 6th or 7th reason that older adults go to the emergency room. Then you've got the spiral of physical weakness. So stay out of the hospital. Help your elderly parents manage and take their medications correctly. Elderly parents who have these chronic health issues and they don't take the medications, they're more likely to have more health concerns and be in the hospital more often. Number 9, medical care for aging adults is provided and is available in a variety of settings. So we talked about the fact that, yes, they can go to the emergency room. They can go to a doctor's office and get care same day. You can have an urgent medical provider come to the home. If your elderly parents live in care homes, retirement communities, assisted living, memory care, and nursing homes, there is medical care there. As a caregiver who has a HIPAA release, you have online access to medical portals that can make communication easier. Physician practices are now visiting some care communities. So the idea is we're trying to make getting medical care for the elderly easier, but it takes a little bit of investigation to find out what options are available for you and an elderly parent. And the last one, number 10, having a medical power of attorney and a living will are critical so that the wishes of aging parents can be followed. Without these documents and choices, individuals can lose the right to make their own medical decisions. Remember the Eat Cookies 17-minute video. If you have not yet watched it, there's still time. Check it out. You will understand why this is ever so important. Another thing that's important is having a physician that you trust. I always say having a physician you trust is a must. As elderly parents age, transferring care to a geriatrician who specializes in the care of aging adults is a practical step. Although depending on where you live, it may be a challenge to find a geriatrician who is accepting new patients. A backup plan would be seeing an internal medicine specialist. Check with your parents' health insurance plan for doctors that are in the plan. Depending on where you are, if there is a shortage of a geriatrician, it's okay if a medical practice has a wait list. Sign up for that wait list because eventually an opening will arise and your parent will be able to see a geriatrician. But if you can't find one right away, check into internal medicine physicians. That may be the next best option. The difference between a family practice physician and an internal medicine physician is that family practice physicians, they care for both children and adults. An internal medicine physician, a geriatrician, treats only adults, and both specialize in the chronic diseases that affect adults. Let's talk a little more about the value of physician specialist, and get your pens because I'm going to give you a list of the names of these specialists so that you can ask for referrals. Physician specialists are valuable when elderly parents have multiple chronic conditions that significantly affect daily functioning. You can learn a great deal from asking questions of specialists. The types of specialists include a cardiologist for any type of heart issues. A pulmonologist treats breathing issues like COPD, asthma, bronchitis, allergies. A gastroenterologist treats stomach and intestinal concerns, If you smoke, you definitely want to see a gastroenterologist. If you burp, if you have GERD, if you have irritable bowel syndrome, all of those, it's a gastroenterologist. That's also the person that you go to get a colonoscopy. A rheumatologist treats arthritis and sometimes endocrine disorders, but more likely you would go see an endocrinologist for thyroid issues, for diabetes issues, and just for hormone issues. Endocrinologists are great for women. As you can see, there are many medical specialties. They have the expertise that can vastly help and manage and improve medical conditions. You would be surprised by learning to coordinate care between all of these. So between a primary care physician and a specialist, all of these chronic medical conditions that are advancing will be better managed. And the recommendations of specialists really can help stabilize the health of elderly parents. I have had clients over the years that I have taken to specialists, and I'll talk about one. His name was Ramon. He had tummy issues, so we saw a gastroenterologist, but he also had breathing issues, so we saw a pulmonologist. The gastroenterologist identified that he had a hiatal hernia, which we treated, which resolved horrible stomach upset and burping and gas. He was so miserable. After that hiatal hernia was treated, different person. The breathing issues were related to pulmonology, and believe it or not, he had a sleep disorder that when he slept, it's called sleep apnea, he would breathe in air and he would stop breathing for periods of time. So sleep apnea for him was diagnosed through a pulmonologist specialist, and he got a special mask that he wore at night when he slept. So just improving these two conditions, if you can imagine just being horribly upset tummy, burping constantly, then you can't sleep, so you're sleepy all day. Resolving those two chronic conditions significantly improved this gentleman's life. But you don't get there unless you keep asking questions and unless you go see a specialist who can help. Okay, so a summary. I really can't encourage you enough to go see a specialist if there are multiple chronic diseases that are significantly affecting your elderly parent. They are valuable. We talked about the types of specialists. We talked about the fact that you have to become more involved if you want better care for elderly parents. You have to become more involved in medical conditions, in understanding the effects of the diagnosis, and talking about what you can actually do about it. So it's not just getting into the fact that, yes, my parent has this diagnosis, it's horrible, but what can we do about this? What can we do to make the lives of our elderly parents better? And if you're not getting anywhere with a current doctor, don't hesitate to ask for a referral to a specialist. Don't hesitate to ask for a second opinion. You have to do that. Nobody's going to do that for you. It's up to you to make sure that your elderly parents get the care that they need. You can do it by advocating. You can do it by seeing specialists. I'm Pamela D Wilson. Thank you for joining me for this webinar. I look forward to having you with me in future webinars and to continue these discussions that take us chronologically, step by step, through the medical system, through the healthcare system to get better care for our aging parents. I look forward to seeing you in the next webinar.